Welcome to what shall be the final in this 4-part series where we were focusing on menstrual health. This is Heartbeat, and I am Robert Mukondiwa. It has been an eventful four episodes, and we hope to wrap it up this time with a commitment and a call to action. My guests today are coming to make that call to action. And I'm going to ask them to quickly identify themselves and why they're interested in this topic. But first, because we are graced today by Her Excellency, the Swedish Ambassador to Zimbabwe, who has made this 4-part series possible. First, I'd like to thank you profusely for helping us, for bringing this discussion to the world, really. And I'll ask you first to identify yourself.
Thank you very much, and thank you for having me on this show with an extremely important topic. For Sweden, menstrual hygiene and health is a key developmental issue because, of course, it relates to the life of all young women and girls and their ability to educate themselves, to find work, and to live and lead a normal life. So for Sweden to invest in menstrual health in Zimbabwe together with our partners, it's one of our key missions here. And I'm really pleased to be here today and discuss these important issues with distinguished colleagues from this country.
And we're pleased to have you. Thank you so much. And then we'll start from you coming here.
Well, my name is Mandy Tembo. I am a PhD research fellow with the Biomedical Research and Training Institute here in Zimbabwe and the London School of Hygiene and Tropical Medicine in London. Menstruation is extremely important to me because it is what I'm studying for my PhD, assessing how women experience menstruation in Zimbabwe, what factors inform how they practice, what they think about menstruation, what they know about menstruation, but also on a personal level because I am a woman myself. And I don't want to say that women's issue is definitely a human issue, but to say having that lived experience definitely enriches and definitely drives my passion for the subject.
And we're pleased to have you. Thank you so much.
Thank you, Mr. Mukondiwa. Afternoon, everyone. I am Dr. Bernard Madzima. I'm the Director for Family Health in the Ministry of Health and Childcare. And issues of menstrual health fall under my portfolio. So I'm glad to be here.
Thank you. We're glad to have you.
Hi.
Hello.
Thank you. And I'm happy to be here to share a platform and just hear what people are saying. My name is Esther Muia. I'm the United Nations Population Fund, or UNFPA in short. UNFPA is the UN agency that deals with sexual and reproductive health, but I'm the country representative in Zimbabwe. I'm interested in menstrual health because, first and foremost, I've been through it. I've raised children through it, and now I have grandchildren who are going through it. And secondly, as UNFPA, as the Sexual and Reproductive Health Agency, menstrual health is a key pillar in sexual and reproductive health and rights. And as said, it's a rights issue also.
Thank you, and we're pleased to have you.
Thank you.
Thank you very much. My name is Brian Pinduka. I'm a lawyer with the International Commission of Jurists. Really what I want to just speak to today is just the human dignity element to this, and to link that with issues of development, sustainable development, and see how these two interact and how we can start to have a conversation that brings together an issue that's not mainstream into a public forum that you can actually debate and look at. So basically just to talk.
And it's interesting that you mentioned that because we've been going through over the past 3 episodes the lived experiences, as you say, of certain people. And we came up with a little video that I want us to watch first before we start, discussing the issues and perhaps see other people's lived experiences.
Women and girls in Zimbabwe lack adequate facilities to manage menstruation. Imagine using cow dung, leaves, rags, papers, due to lack of sanitary wear. Water challenges also worsen their plight. The lack of education on menstruation has seen boys and men lacking understanding of all these challenges, resulting in women being humiliated and victimized. Women and girls suffer in silence. In Zimbabwe, prices of sanitary wear are skyrocketing beyond the reach of many, forcing young girls to miss school during menstruation. Sexual reproductive health rights activists believe the solution lies in the provision of free sanitary wear. Hashtag break the silence. End period poverty.
I'm probably going to sound like a broken record for people who've been watching this, because I've been saying all along that this song is a very somber, sad song. I don't know, we're talking about a serious issue, but I don't think it's a sad issue. But apart from that, those are the lived experiences. People are talking about using rags in place of sanitary wear. People are talking about the pricing, lack of accessibility. And you know, people are asking, and they have been asking for quite a while, you know, that can we have access? Can we become decent? But I think the reason why we brought you here is probably we need to go a step further and say people need to demand. And how do we hold authorities to account and say this is very important and our girls really need to have sanitary wear, even if it means we need to legislate. What's your view on that issue?
No, I totally agree. And the way that I was looking at it was from a constitutional perspective. We have a fairly new constitution that is trying to change the way society is structured, trying to change the way the world is ordered and move people to a more dignified, equal perspective. We have now, for the first time, an expanded Bill of Rights, which includes economic, social, and cultural rights, which includes the right to healthcare, for example, the right to education, the right to dignity, all of which are rights that everyone should enjoy periodically as a matter of right because they're citizens of Zimbabwe. And the factors that you've just highlighted in the video show that there are issues of dignity that are affected by the expensive price of sanitary wear. There are issues of education. It talks about students who are unable to go to school because they're going through their period. And these are things that we need to start to interrogate and start to have discussions about and see how we can then hold our government to account and hold our government to its duties and responsibilities as enshrined in the Constitution. If you looked at the way the Constitution is framed, it talks about the progressive realization of these rights, these social and economic rights. And I think there has to be a starting point. There has to be a minimum core content that we must start from and progressively move towards achieving realization for the girl child in particular.
Absolutely, absolutely. And Ambassador, watching that, and I know for certain that perhaps in Sweden you may think you've not arrived yet. You know, there's still certain loopholes. There's still something that can be done to make that experience easier. But this African experience, talking about even the use of cow dung, there must be a serious disparity that is absolutely shocking. And how do you address that as you know, as a government, especially on a government-to-government level, when you're trying to assist the nations to which you're deployed and to which you offer assistance?
Thank you. I mean, as we heard in the video and also right now, I think it's an issue of dignity and of respect of rights that the Zimbabwean government and people and everyone in Zimbabwe is entitled to, as mentioned in this very progressive constitution that I would like to highlight is one of the most progressive constitutions in Africa. And obviously as a partner to the people of Zimbabwe and as a country with a large development cooperation program here in the country, we will and we do try to do what we can in order to assist the government, but more importantly, the people and the young women and girls that are facing those challenges and this situation that cannot be described as anything else than I think a lack of dignity, but also a lack of accessing other rights. I mean, the right to education, as we heard, not being able to go to school because you're going through your period, or not being able to work, or not being able to take active part in life. So what we're trying to do is to work with our partners, UNFPA being one of them, but we also partner with a number of civil society organizations such as Say What, PSI and PSZ to provide education, to provide also practical issues, but then of course in our interaction with the government, and I'm very pleased that the Minister of Health is here, because that shows of course that also from the government side there is an interest to work with us and partner with us as development partners, but also with the other organizations in the country to make sure that we can address this issue, because obviously it's an issue that can be solved. I think we heard about the access to sanitary ware, but also in terms of education, and make sure that girls and women have access to menstrual health is key for the development of the country in so many ways.
Absolutely. And the lived experiences, you talked about the lived experiences and you saw these experiences. And what comes to mind when you see what other people are going through in their day-to-day when they confront issues of menstrual health?
Yeah, I think the biggest message is that menstrual health, or attaining good menstrual health, is not just about access to products. It's about informed choice. So that education aspect is critical, not just on menstruation, but on puberty in general, and not just for girls, but for everyone in the community, because that shame that comes with your period, that lack of knowledge, lack of discussion, is all because people aren't speaking about it. So mainstreaming and normalizing talks around menstrual health and menstruation is absolutely critical. Then we can talk about products and making products available, making sure that girls are making an informed choice. And beyond that, we have to talk about stuff like water and sanitation, because a big part of how women manage their period is because they don't have access to water or a clean bathroom or a safe bathroom at work, at school, or at home. So it's this holistic understanding of what menstrual health is and being able to address that at all different levels. And so that's the practical side of it, but also the idea that we're having this discussion is also quite critical. And hopefully that initiates conversations in homes, in schools, and at work, and it allows for the sharing of knowledge between people who do research, and we can provide information on what girls want, what are their lived experiences, what do they go through. Then that can be informed to the public, that will sort of drive advocacy and a demand approach from the population. But also advocates will have that information and be able to use that to really drive policy and tangible and a sustainable change over time. Absolutely.
And you talked about education, and definitely the Ministry of Health needs to start perhaps mainstreaming this discussion. What are you doing as a ministry to try and break this down and say this is it's even in schools, this is not a subject of shame, this is a lived pride, because this speaks to life-giving essentially.
Okay, thank you. So I think Robert, the good thing is that as you heard from the previous speakers, my colleagues here, is that we are preaching to the converted. Everyone is agreeable that this is a human rights issue, that every girl or woman should access menstrual hygiene. So for government, for us really, it's actually to prioritize this issue of menstrual hygiene. Unfortunately, over the past decade or so, because of the economic meltdown, most of the things which were taken for granted prior to 2010, they have now become very important. I think issues of menstrual hygiene were not coming up. We're more seized with making sure that hospitals are doing cesarean sections, we are averting under 5 deaths. But I think when the prices for pads, for example, went up, and when we had to import things like sanitary ware, I think this is when people then realize that there can actually be a huge cost to these things. And who is affected? It's mainly the poor rural and poor urban. They can't access sanitary pads, and then we end up with the issues which are now being highlighted. So in this situation, government has to take charge. We have been engaged with the various ministries. As Minister of Health, we come in from the health aspect, but we also have Minister of Education, we also have Minister of Women's Affairs. We've been trying to look at what has been happening over the years. If you check in the industry, the companies which were manufacturing pads, for example, they've closed. Over the past few years, 10 years or so, they closed. We had Meditech in Rua. Right now, we have one company, I think, which is... So what is happening is that we're importing pads, and they've become expensive. So we need to look at this beyond health. We need to look at it from the government level. That's the one we should coordinate all the ministries and make sure that we have pads which are accessible, which are cheap, or even for free. I agree with that. So as government, we are on board. We are happy that with the support which we are getting from our partners at the moment, which is bringing back dignity to our girls and women, UNFPA, Swedish Embassy, they've been quite supportive. But I think as government, we also need to take charge and make sure that we have locally available pads. The other discussion which has come now, which maybe we'll discuss later or has been discussed before, is the issue of the disposable versus the non-disposable. Maybe it's another discussion which we can discuss. But as government, there has to be something which is basically available to every girl and woman in this country. After all, they constitute more than half the population in Zimbabwe.
Absolutely. And we're talking about pricing. It isn't getting any better, is it? Because even today, we woke up to news that even condoms, for example, have doubled in price. I think it's over 100%. And that means agencies and organizations like yours, Esther, are now faced with an even greater task in order to plug that gap as well as reach those that are in need, really.
Yeah. I'm looking at it, I'd even love to look at it as menstrual management. You know, the moment we talk about menstrual health, menstrual hygiene, we're putting it in a silo. And much as it's referred to as that, I think it's important to see the bigger picture, because women have menstruated from time immemorial. How did they used to manage so that they still had their dignity? Where have we lost it along the way? It's not just about the economy and the procurement. I think it's about taking responsibility by everybody. I'm not going to repeat, it's a human right. And it's everybody's responsibility to ensure that the rights of people are adhered to. So menstruation should just be taken like any other part of development. We talk about nutrition as being critical in development. And, you know, we all run around when there's a drought. However, nobody looks at what are the effects of poor management of menstruation that then can undo all the gains that you're making. And like you're talking about, pricing is one thing. And I would have loved to see the Ministry of Finance also in this discussion, because in many, many other African countries, the Ministry of Finance is actually taking it upon themselves to ensure in the annual budgets that this is factored in. And why do they do that? Because they've recognized the fact that to education, what causes school absenteeism with girls? It's not just about being unable to have pads. It's also the period pains they get. A lot of girls don't even know what to do. They get cramps so severe that they throw up in the morning, and the parents think they don't want to go to school, but they are really sick. It's a physiological process, but it takes different directions in different people. And that's why, for me, I think it's about managing. It's not just about hygiene. It goes beyond hygiene. And then what is the role of even fathers and the men around the women and girls during menstruation? They have a big role to play. When I was growing up, I grew up with my father. And I remember when I was doing the list for going back to boarding school, he'd always ask me, where's the modest? Those days we had what pads called modest. He could afford, but I could get to school and you see these girls take a piece of cloth and wrap it and use it. And you're like, why don't they have pads? And it's the same thing today, many, many decades down the line. We need to do something and stop just talking. And that's why, as UNFPA, we've been working very closely, both with Ministry of Health, Ministry of Education, but also Ministry of Women, Culture, Small Medium Enterprise. And we've also been working very, very closely with support of, especially with Swedish support, looking at, is there something that can be more cost-effective and more practical to go with the times? If we've stopped being analog and become digital, why is it we are not becoming digital in managing menstruation? Why should people be using cow dung and banana leaves? And when we are talking about becoming an upper middle income country, we just have to walk the talk. And this is where, as UNFPA, one of the things, and based on research, trying to see an approach that is cost effective. There's a menstrual cup. This menstrual cup, we've tried it out in communities and people have really liked it. It costs a little more, but it lasts forever. Why? Because it solves the problem of disposable pads and reusable pads. It's about you just clean it and reuse it. And the girl walks with it, there's no discomfort. The only thing you have to deal with is her period pains, her cramps, her headaches, to help her then go through the day. The other thing that we've done is under a community outreach program, again under the Health Development Fund with support from Sweden and other donors, we've been working with young girls and getting a mentorship kind of program. We call it Sister to Sister. And it's not just for girls in school, but also girls outside. Why? So that we use them as behavior change facilitators amongst their peers. Because they've been through it, they can discuss with others, and they help them go through it. And finally, one of the other things that we've done is to address this issue of reusable pads and said, what is the best way to do it? And looking at what other countries are doing in the region. Because remember, there's no need to reinvent the wheel when things are already. Look at it, how can we adapt it? And we are, as UNFPA, supplying what we call dignity kits because of what they are, dignity, soap, pads. And the pads we give are actually washable. And therefore you can reuse them, and they've got a base. I should have carried a sample. And you just put it in, and you use it for a few hours, and change even when you're at school. It comes with a little bag, plus little bag that you can wrap it in and keep it in your school bag. It's not bulky. And when you get home in the evening or to the dorm at night, you can wash them, hang them out with your underwear, and it works. We also include in the dignity kit 3 sets of underwear because, like Dr. Mazima said, it's the poorer ones. We've been to places. The most recent one that's still fresh in my mind is Bindura, where even they do not have underwear. So how do you expect them to use a pad when they don't have underwear? And now the idea is to look at how can you get the communities to come up with a way of having underwear for women, because it's their right. It's part of dignity. So it's things like that that we are addressing, trying to use a very practical approach. We don't want to create a dependency syndrome. We want people to be capable of independent existence. Absolutely. And therefore, that's why we work with government to look at what is the most practical way of addressing this. And talking about condoms and pricing of medical products, it's not going to go down. It's going to continue rising. Are we going to stop using them? If we stop using them, we will reverse all the gains we've made. Now, if people don't use condoms, what's going to happen? Sexually transmitted diseases, including HIV, is going to resurge. and we are going to go back where we were 10 years ago. If we continue depending on imported sanitary wear for girls, what's going to happen? We're going to go back to the same stage. So can we work together with all partners? And I think this calls, for me, the rally call is, can we come together to change the lives of women and girls so that they lead a dignified life? We reproduce because we are menstruating.
But you talked about partnerships, and it's important because we have to spread the. It's very easy to point a finger because especially the Ministry of Health always gets all the flack, and when you're speaking, for example, it brought me back to issues like even water, which you're not even responsible for. We're talking about providing solutions. We're talking about reusable pads, and Madam Esther is saying, you can, when you get back to the dorm, you can wash it and then hang it. But something as simple as washing it means you need water. And I'll say this because at one time or another, we've actually been to your offices, and there wasn't actually water at your offices as well. And this is something that we've got and we're facing this as a nation. And so some of these interventions might even sound very simple, but there's always going to be another problem that compounds that. And how are you engaging, your partners to say, fine, we may provide this, but we need you to provide for the other little bits to make this wheel work?
Okay, yeah, I'm glad you actually mentioned it, that the flag normally ends with Ministry of Health. It happens even in cholera outbreaks, in typhoid outbreaks, that people say, ministry, but we don't provide water for Harare, for cities. But at the end of the day, maybe what we should do then is to make sure that we alert the other players, the other ministries, the local government, that if they don't provide certain services in water and sanitation, like what my colleague here said, then we are going to have problems. These reusable pads, we have to train the girls and women to wash them and dry them properly. So if there's no water, then there is a challenge. So for me, it's a whole big issue of how do we do the environmental factors, the determinants for good health. How do we address the determinants for good health? And this is what is now coming out. If you don't address them holistically, you then face these unique challenges and you think they've just sprouted up. People have been having menses, like she has said. So, yeah, we need to take charge. We need to take charge of some of these things, especially the social aspects of our existence. I think government has to take charge. I think over the past few months, we've had announcements of surpluses in government, but also coming from Ministry of Health. I want to testify that since the beginning of this year, for the first time in a long time, we are starting to get some releases coming from government. So as we go into the next year budget, I want to please urge our legislators, ministries, to lobby, to make sure that these items like sanitary wear are put in 2020 budget. And whatever comes from ministry. Because I don't understand why we should import pads for a start. This is cotton and bandages and paper. Why are we not manufacturing pads? So there should be that call from everyone, from all the stakeholders, that even our partners, they might even say, you know what, this thing you have to procure it yourselves. Why are you not manufacturing pads? Why are you not reviving industries like MedTech in Rua? The equipment is there, but it's closed. So how much foreign currency are you going to save if you stop importing sanitary wear? So yeah, I want to agree with my colleagues here that government has to prioritize this issue. And
you're talking about a call to action, really, because as part of our audience today, we've got people who are going to take you to task. We've had people who've been on the panel. Firebrand people, really, and on the second segment, they're going to be speaking to these issues. But at the moment, we're going to take a quick breather, and after that, we're going to speak to them. They're going to give you a piece of their minds. They've given me those pieces over the past 3, and I just want you to get ready because they're very, very firebrand. And Heartbeat will return in a heartbeat.
Menstrual health is not just a women's issue. It affects all of us.
As a woman, I understand that my period is a delicate time for myself as well as for other girls who go through exactly what I go through.
I'm Ruti. I stand with women and girls in breaking the silence and saying my period is not shameful.
I'm Andy Hodges. I stand with women and menstrual health. Make sure you break the silence and break it now.
My name is Candice and I will be helping you break the silence on menstrual health and menstrual health issues.
I am William Chikoto, Zimbabwe's editorial executive.
Farai Matanire, the Group Finance Director for Zimbabwe. I stand in support of women and girls in breaking the silence on menstrual health.
It's not a women's issue, it's a developmental issue. Let's break the silence.
My name is Tendai Marion Maziova. I suffer from endometriosis. I am here standing with every girl and every woman in breaking the silence on menstrual health issues.
Welcome back to Heartbeat, where we look at issues that affect your health and your well-being, because your health is your wealth. This four-part series has been made possible by the Swedish Embassy in Zimbabwe, by PSI, and we are proudly dressed by Jan Jam, because Jan Jam is always a good idea. In the first bit, we were talking about really trying to get to the crux of the matter. But now we're going to go, a little deeper in it and ask bits and pieces of our Firebrand audience to give us what they think. We're also graced today by Willis Watafi, who is an artist and a communicator and worked actively in Artists for Health. I remember there was this lovely little piece that we did in, I think, 2009 when we were trying to address the cholera epidemic then. And it was absolutely, it worked, did it not? And so perhaps let's have a word from you. You're here, you're a communicator. Why are issues of health important to you, and why is this subject important to you as a person and as a personality?
All right, to start with, I take responsibility as a citizen of Zimbabwe, and to say that I'm a vision partner as far as health is concerned, and we seek to address at Kaya Roots Foundation the health and education of women and children. So girls are affected in this case, in this instance. So we are saying that this is a call to action, and it's not about, it's not about girls or women recognizing this issue, but about everybody else saying we are coming together and in one voice. And I'm a musician. Better a message being sent out by a person like myself who has a following, who has no scandals, who will go out there and speak boldly about anything, without fear, as opposed to, how other people will have reservations. But I've become a mouthpiece, so I shall remain that way. And this is why this is very important to me, to be part of this initiative, a call to action.
Absolutely, I like how you so comfortable about your image, and you've got no scandals. Perhaps now, could you just assist Nigiwe with the microphone? Yeah. We had her in the very first program, and I must tell you, you're a rock star, because everybody was like, that woman gave us a different perspective of the issues. Now these people here are policymakers, and they are making things work. And you made demands the last time, and I want you to tell us those demands, because those people are here. The responsible people are here. If we need to give them a bit of a beating, they are here. And so, rant on.
Okay, thank you so much, Robert. First of all, for me, I'm very passionate about seeing people with disabilities. It is not to be left behind in everything, in every decision. So, last time I said that I applaud the Minister of Health and everyone who has invented all these other alternatives for menstrual health issues, like the washable pads, the menstrual cup. But the reason why I'm here is I want to put a task to these people that, yes, you have helped with all these things, but you always have to put in mind people with disabilities. So for example, myself, I can't use the cup, I can't use the washable pad because I won't be able to wash it. So that's what I really want to say, that you always have to put people with disabilities in mind, because it's not everyone who can use all these other things. And the other thing is, or maybe because every time people with disabilities are always left behind in whatever, it's either economic issues, social issues, or whatever issues, people with disabilities are always left behind. So I don't know if there's a way out that you can help women and girls with disabilities, especially those in the rural areas, or maybe if there's any way that they can get free pads or something that they can be able to help themselves. Because if you look at it now, pads are going for almost $20. And for someone like me, pads is the only thing that I can use. I can't use any other thing. I can't use tampons. I can't use any other thing. And pads is the only thing that I can use. And for someone who is in the rural areas, who is not even working, who's just at home all day, for that person, it can be very difficult. So my call to everyone who is here, I'm very happy that the Minister of Health, they are here, they have a representative here. So please, something should be done for young girls and women with disabilities so that we have options, so that we won't be able to use something just because that's what we have or that's the only option that I have. But I need to have options to use something that I'm comfortable with, something that is accessible for me. So yeah, thank you.
Inclusivity. And I like the fact that you actually talked about that. That we just don't want to have affordable pads or free pads. We want to have a choice. You want to choose what you want to use, what's best for you and your personal experience. We had quite a bit of a lesson the other time. We were being shown tampons and pads and the menstrual cup. So there was, and it's all about choice, really, and informed choice as well. And another person who was talking inclusivity. If you'd like, and I know I have to get ready for this, and he knows because he's gonna give me quite a talking to. But yes, and that's you now. Hand him the microphone because he was talking about inclusivity. But what I like about, and last time I said, you know what, I want to restrict your talking because I know when you're passionate about something, we could go on and on. But today, listen to this. You've got a full license to go on and on. Now tell us what's at the bottom of your heart, Sandis.
Thank you. Thank you so much, Robert, for the open check as well. But just to say, my name is Sandisa Lovu. I'm from Sewat. So I'll of course mix perspectives from my sister on disability, but just to say we are running a project with a unique group of people called Mugota. It's derived from a Shona hut where boys sleep. And it's Ikliva in Dewele, and I hope I'm getting it right, Watafi. Ikliva, yeah. And that's why you also have different perspectives about menstrual health and management from boys for different interests. So I will share some of the things that we are doing, in support with the Swedish Embassy. But one of the things that boys were raising, Robert, is that government is at the center of this whole issue of menstrual health and management. So, for example, the Minister of Health needs to coordinate for me, because today we're talking about solutions. An interministerial response to the menstrual health and management issues. For example, we have Section 76. My good lawyer there talked about this being a rights issue, which provides for the right to health, including reproductive health. But it's not clear, if we're talking about reproductive health, in our beautiful constitution, what exactly are we talking about. And I think menstrual health and management sits squarely in reproductive health rights. So I think that program also needs to be rolled out clear and loud from the Minister of Health to say, that provision, what does it mean to the citizen out there, so that we have the constitution and we also have people enjoying the rights. And the interministerial space that I was talking about, in 2013, for those that are following budgeting processes, it was announced in the Parliament of Zimbabwe by the then Minister of Finance, Tendai Biti, that there is tax exemption on all products that are procured meant to produce sanitary towels. But I don't think that was ever implemented. So for me, you can see that our government needs to say one thing, implement other things, but there is a lot of opportunity for domestic funding and also to create friendly policies to ensure that menstrual health and management is enjoyed by everyone. And then I will move to my second issue, Robert, which is the linkage between the Ministry of Health and the Ministry of Primary and Secondary Education. So by statistics, we have over 4 million learners in primary and secondary education. We have over 155,000 learners in tertiary education, but we don't have a curriculum that speaks on comprehensive sexuality education, which can say it can tackle and address issues of menstrual health and management. So menstrual health and management should not be an accident, but young people, young women should be prepared to deal with that. People are very proud to say girls miss 3 or 4 days not going to school to learn mathematics, but the government is not intentional to teach or provide information on what has made them not to go to school. So it's, for me, it becomes a paradox to say a young woman, a girl, a female student is not going to school and you're worried about mathematics and biology, but you are not worried about educating that girl to how do you prepare to manage that menstrual cycle? How do you prepare boys to understand what is happening so that they don't stigmatize? How do you prepare teachers to handle learners in terms of menstrual health and management? How do you prepare institutions to be able to contextualize in terms of social inclusion issues of incinerators, issues of management of menstrual health, issues of disposal? You know, you built a very nice school where there is no incinerator. So for me, there was no inclusion in the first place. And coming from, I got disabled in 2008, and that's when I began to enjoy being left behind. You can tell that in planning, people never thought about people with disabilities. You can also tell that in planning, people never thought about menstrual health and management when they were coming up with the school. And lastly, I was happy when my sister was talking about the PhD program, just the research bit on menstrual health and management. So one way of excluding an issue is to deprive it of evidence. And in disability, since 1980, I think and since Zimbabwe, or before Zimbabwe, there were people with disabilities. But up to now, we don't have data on people with disabilities. Up to now, there is no data at national level on menstrual health. What needs to be changed? How? There are no indicators. So for me, the Ministry of Health as an action point, we need to be intentional in having more research, more indicators, so that when you go to policy levels, what needs to be done and changed? We are speaking evidence, we are speaking data. So no evidence, no response. It's as simple as that. We cannot continue to drive menstrual health and management using passion. That's not the best way. It has to be evidence-based, data-based, and then we have a systems-based response and thinking. And then lastly, I'll conclude by this because I'm enjoying the license. I'm enjoying the license. I wish you could bring me again and give me a better and bigger license to talk and talk. But I'll leave others with the similar license. So she has mentioned it. Women are not a homogeneous group. I think I said this before. Women are not a homogeneous group. And I don't agree to the notion that if women are poor, then we should look for poor products to manage menstrual health and management. They are human beings. They have human rights. They should access the highest quality of sanitary towels. Whether disabled, poor, no paint, with paint, they've got similar rights. There are no rights for women who are in rural areas, in urban areas, disabled. And that will even help us to analyze and understand deeper in demographics and trying to be more particular and focused. Even in disability, some women have visual impairment. They might not even see all this good advice about menstrual health and management. Some women use sign language, and no one really cares to tell them in sign language how to manage the period. Some women have got mental challenges, and sometimes they are very mobile, and they don't even know what to do when when the menstrual issue comes. So I think for me, it's time for a systematic response instead of a passion-based response. I thank you, Robert.
Okay, and next to you is a very firebrand person. We're going to come back to you, but I wasn't overemphasizing when I said you've got quite a bit of a job here with these people. These people know what they want, And they're speaking for a demographic that includes me, because when we brought you here, we brought you right at the tail end to as a call to action to what we've been discussing as the ordinary folk, as your day-to-day folk. And statistics, the best way to exclude somebody is not to have any statistics on them, Sendisa said. And it's a great thing that you're working on this. What's your take on what Sendisa said in particular?
Yeah, I guess I have three points from what you have said. The first is when you define sexual reproductive health and you put MHM at the core of it, being menstrual health management, I totally agree. And to give that as a definition, the WHO in 2012 said adequate MHM is having access to water, access to products, access to be able to wash your product or change your product when needed, access to education. And this whole idea of a holistic approach, it's also about stigma, dignity, and feeling free to be educated and to talk about the narrative of menstruation. So as sort of a directive, when we want to put it into policies, these are some of the critical points of what MHM is all about. In regards to the idea that women are not homogeneous, I completely agree, and research is critical to sort of defining that. So a big part of the work that we do, not just in Zimbabwe and as part of my PhD, but across East and Southern Africa, there's a lot of studies that have been done in Kenya, Uganda, Tanzania, and only starting now in Zimbabwe and South Africa, but addressing the idea of if we give women information about products and we give them a choice of products, from the menstrual cup to reusable pads to period underwear, which function as normal underwear but with an absorbent within it. What do people choose and why do they choose to use that product? And that's for all women. So we might find that women with mental impairments don't know how to use products, so we have an education program that allows them to use dolls as simulation, to talk about where the pain is, to talk about how much happier you are if you change your product at this time. The idea of girls in schools and addressing anxiety and shame and talking about how your period is something you should be proud about and something you can plan for so you don't have that anxiety. So definitely there's evidence that is being incorporated, and what we're working as a coalition across East and Southern Africa is standardized measures. That way we can say across the board, here's the things that we need to address, and this is where Zimbabwe is, this is where South Africa is, and we know where we need to go. And also the idea of standards of products. So we're not trying to, the narrative I understand is that reusable products are for poorer people, but that's not at all the facts, right? Because they're used across the globe. It just so happens that in the Western world, the narrative is more around sustainability and being environmentally friendly, because the idea of cost is not a forefront concern there. The forefront concern here in low-income countries, middle-income countries, is the idea of cost and cost-effective initiatives. And that's why I think the message is driving around providing products for less income individuals. But that's not at all the case. We are really about trying to find cost-effective ways to manage menstruation for young girls across the board, and collecting information on what type of products are the best for different populations, and how do we message those products so people are informed and don't have a stigma towards something that you insert in the body or something that you have to wash. And that's the main concern for research. And I think what we've all agreed here is that research can't stay within academia. We're not writing papers for just ourselves. We are giving evidence so that policymakers can use that evidence to drive change.
And Ambassador, I'm going to ask for your take on what people said. But first of all, kudos. People have been referring constantly to how your country and your embassy has been partnering with them, and your name has been synonymous with this. But before you answer, or give us your contribution, I actually want to let people in on something. You arrived from Malawi, was it today?
Yes, this morning actually.
This morning. Now, and you're leaving Zimbabwe, I'm told,
yes,
in a couple of weeks. And that's just the level of commitment that she flew in and said, I want to be part of Heartbeat. And she came to our studios. That passion, and I know Sendisa said, passion alone will not fix things, but it's a good starting point, and we're very happy that you came and joined us straight from the airport. It shows that it is a form of great currency, and I would like to thank you for that, because we didn't get time to talk about that, and also the fact that if it were anybody else, me for example, leaving anytime soon, I would say, well, look for somebody else to deal with that. I'm going on vacation and I'm leaving this country for good. But that passion, that you're still interested in the intimate experiences of Zimbabweans is something that we totally appreciate. And now to your contribution.
Thank you very much for that. I mean, I would obviously I spent 3 years in this country, and when you talk about passion and commitment, obviously as an embassy and as an ambassador, I can try to contribute. But I would like to highlight the passion and commitment of the Zimbabweans, who are actually the ones who are driving this. And we heard fantastic and very powerful accounts from Zimbabweans from different walks of life on how this issue is affecting them. And as you say, I mean, I'm an ambassador, I'm flying away, but the Zimbabweans and everyone here are the ones who are staying and who is dealing with this issue. So the little I can do by participating, I really think it's the least I can do, because I have come to love this country, to love these people, and as Sweden we remain deeply committed to the development in Zimbabwe. And as we have heard, I think a key issue is the holistic response that is needed in order to address menstrual hygiene, and how this issue of menstrual hygiene is linked to the whole set of development challenges that Zimbabwe is facing and that we are trying to assist with. Some of the issues that come to my mind listening to those interventions is, of course, how we can address the needs of different groups, and to be very humble about that different groups have different needs, and where I think research is also very important, but also to give people a platform to speak out about their needs and how their rights can be addressed, because we also heard that in the beginning of the program this is a rights issue. It's rights that are enshrined in the Zimbabwean constitution, and that belongs to all Zimbabweans, regardless of race, sex, gender, disabilities, the issue of inclusion and dignity. I really think that is extremely important how we can work on that. So what is needed, of course, is this holistic response. We have the issue of products, we have the issue of education, but we also have the issue of stigma and culture, and how to talk about the issues of menstrual health, sexual and reproductive health and rights of all groups, be it people with disabilities, be it men, be it women. So to the extent that we as development partner can contribute, we invest around $30 million. No, actually now with a bad exchange rate for the Swedish crown is more, but around, let's say, $50 million a year in Zimbabwe in development of various kinds, sexual and reproductive health and rights being a key of them, and where this subject is definitely something where we do think can work as a catalyst, because to talk about an issue that is very much a taboo in many ways in Zimbabwe, it's also about opening up the society and talk about issues that concern everybody, that has not been talked about before, and how we jointly can address them. That's also something that's been talked about, which I think is important, that it's something that we need to address together, and we need to come together. So I would like to thank the participants to be brave and to speak up, and that as Sweden we will continue to support you in the ways that we can here in Zimbabwe. And although I will be leaving, I will definitely be thinking about it and following the situation with my colleagues. So,
Thank you so much. And you talked about how we need to, open up the discussion, and we're going to talk to somebody else who's going to talk about opening up the discussion in churches, because that's where we go a lot, and that's where this discussion is sometimes really not talked about, and Apostle Pride Subia is going to talk to us about that. But just before that, let's put ourselves in a speck of trouble right now with the council and the court. Yes. Who's burning with passion. You were talking to me a couple of weeks ago, and I was supposed to account. Now I've brought people who are going to answer you and account. So perhaps today is the day.
Well, thank you so much for having me here. Firstly, I'm so glad I'm here around such people who are in such powerful positions, number one, so we can then begin to question each other and get to the root of the problem. And the first issue that I was thinking about as we were having this discussion, let's start from this side, is the legal terms of the issue. And I understand the Constitution does talk about human dignity and all that, but that's words on paper. what about the action on the ground? That's my first question. Because we're always talking. I've been talking for 15 years. I've been talking for 18 years, if we're to be literal. But what are we talking about? And is it going into action? That's my first question. The Constitution is correct. Yes, we do have human dignity. But are we doing what we're supposed to do to make sure that dignity is being addressed? He was talking about how the Ministry of Health was talking about how, as a nation, our economic status is quite frankly it's dilapidating, and that's what's causing these side effects of what we're having right now. And for us to then begin to look at menstrual health, we would have had to first finish the problem of having people having water in the first place. And I begin to ask the question, my mom always says this, when you have a problem, my question is, Sak, what then? And we're always talking about money issues and how we don't have money to buy pads and how, but it's not a money issue. It's a, what are we going to do about it since we don't have the money issue? And we're not answering that question. Everyone keeps talking about the problems and how we don't have statistics and how we don't have. So what are we going to do about it? I always look at the budget reviews that we have, as he was talking about the budget that we have. And the budget reviews, especially the one of 2018, or was it last year? Yeah, 2018, 2017. It was showing me that over 75% of our budget went to salaries and wages. And then 15% went to the actual implementation of what we're doing. So my question then becomes, what are we spending our money on? If we have $5 and we can budget $5 correctly, then we could be saving a lot of lives. We could be tackling these menstrual issues, problems. But it's a big issue that we're simply not looking at because we're always talking about the money issue of things. And the other thing we were talking about is the fact that we're importing pads. But is the government aware? I'd actually like to have him answer. Is the government aware of people that are starting initiatives within our community about reusable pads? There are people out there in their homes who are sewing reusable pads, but they're not being backed up by the correct people and they don't have funding. But the government is always saying, we're going to do this, we need to do this, we agree to do this. But are you backing up your local people instead of importing? Because when you're importing, it means it's a last resort. You didn't find it in your own country. So please, I urge them to look into our own country, because I can name 5 people right now, or 5 companies right now who produce reusable pads but don't have the funding. The other thing we were talking about, and I really am touched by this, is information dissemination, like she was saying. I know about pads. And when I go to school and someone goes on their period, the first question we ask each other is, do you have a pad? If they don't have a pad. But they never ask, do you have a menstrual cup? They never ask, do you have a tampon? They never ask those questions. Why? Because we are not being given a range of products to say, you can use this one, you can use this one, you can use this one. Yes, menstrual cups are there, but I've only discovered them at 18. So what happened the rest of the 17 years that I was on this earth? What happened? I've been through school, I've been through preschool, I've been through primary school, I'm now at high school, I'm finishing high school. Where is the information coming from? We want to learn. Of course, we want the government or the Ministry of Health to be able to confirm with the Ministry of Secondary and Primary Education to say where is the information being disseminated. We want to see it in the curriculum, but it's not there. Then the last issue we were talking about, I believe I'm getting so confused because I have a lot to say, is the issue of stigma, which really irritates me. But here's a fun fact. 43 women are in parliament. This is opposed to 113 men. So my question to parliament is, when someone stands up, especially a woman perhaps, and they stand up and talk about menstrual health issues, are they going to be listened to? Especially looking at the range of ages that are in parliament. Would they be able to say, let's talk about pads or let's talk about menstrual health without there being someone in the background saying, that's not our issue? You see the age ranges and the amount of gender inequality that is in parliament or even council, because in council you have 8 members who are women and then the rest of them out of 45 ones are men. So my question then becomes, can we talk about it at this age? I can talk about it. I'm 18. I have the confidence. Does everyone else, is my question. So I want the government and all these parts of our country to be able to answer those questions.
Apostle? Now, Apostle Sofia, last time I took you to task and said, some of these stigmas come from the church, and perhaps you would like to start from there and then give us your take on us having this discussion openly and in open forum, starting with especially places where we congregate, like our churches.
Thank you very much, Rob, for affording me this opportunity. I think, like I said last time, the issue of stigma, the issue of lack of information comes from, number one, our cultural perspective, where we are coming from, which then leads into our religious setup, which is basically African traditional religion, Christianity, Islam, and the rest of the religions. Well, I would like to say probably we need to have information, especially as these religious groupings, that basically is starting from us as well, that number one, a woman is God's creation. And according to the biblical narrative, a woman was taken out of Adam, which means that in the first place, Adam actually carried everything, including the woman, the wombs, and everything. So when the woman was taken out, it means then the woman is a man, but who carries a womb. That's the womb man. So there's nothing unholy about this whole thing. So from the church perspective, we are saying the church and religious groupings must understand that there is nothing unholy about this whole thing, because this is where the stigma starts from. So as a minister of the gospel, I am saying I'm taking a stand, but at the same time, I think the government as well should allow for such information, should allow for giving out such information to religious groupings, because sometimes religious groupings are the worst of oppressors when it comes to issues to do with the mindset, the way we view things, and the world view, as it were. Yeah. So I think it could be of help.
Thank you. And Tendai, you gave us a very, very strong story last time, and everybody on Twitter was saying Tendai Mazwofa gave us this very brave, talk, and you changed a lot of people's lives, and thank you for again coming and gracing us. And the people are here. They want to know what we were talking about in their absence, so that we can hack and make this call to action.
I won't lie to you. Sharing that story actually opened up my eyes to a lot of people who have considered friends for years, and I did not know that they were in the same boat. We were all suffering. People started calling me, telling me, you've got 14 days. I go for 18. You only use 2 packets. I used 3. And it was shocking to me that nobody had ever spoken about this issue. And we broke so many barriers by talking about it first of all. But that's not what I want to talk about today. I don't want to talk about my endometriosis struggle, because that's not what this is about. Today it's about a call to action. It's about looking at the affordability of dignity. Programs, including a program that was initiated by the UNFPA on medical male circumcision. When you started with the male circumcision exercise, that was around 2008, I believe. Yes. How come there have been programs that have been rolled out where funders have come in, stakeholders have been included, and a specific program is tailored to bring education to communities, to everybody around, right? I refuse to agree with the learned doctor from the Ministry of Health who was talking about rural girls. It's an all girls problem. We are all suffering. We can all not afford sanitary wear. We might not be able to talk about it in the supermarket and say, oh my goodness, I am not coping with this. But the fact of the matter is, it's an all-woman problem. So why are there no specific programs that have been tailored, like how we did with educating people on condoms, or educating people on medical male circumcision, or educating people on using
fertility tablets. How come we have not rolled out a program, actually set up an office and said, okay, this is going to be the senior program officer, this is going to be the program manager, we are going to resource these funds, we're going to roll out this project, we're going to do this thing, we're going to raise funds. Okay, of course I understand we are here because the Swedish government is in support of this and they have taken up the initiative, but what other program is there that is, Watafi, you've been a part of how many programs that have to do with health in Zim right now? How many? About 10. None of them have to do with menstrual health. That is my big question today. It's not just about talking to the government about reducing pad prices, but how about getting into the communities? Because I've watched documentaries and she's talking about people making pads in their houses. I've watched documentaries of women in India starting community programs to make pads for every rural girl in that community. Why are we not doing that? That is my call to action today.
Thank you. And it wouldn't have been a program, would it, if nobody came out and said, I disagree with the gentleman from the Ministry of Health. There has to be somebody to disagree with the gentleman from the Ministry of Health. And yeah.
Can I just address her question?
Absolutely. I was actually coming to you because, but I just had to tell people that somebody finally said they disagree with the Ministry of Health, which is, I'm tickled by that. But definitely, go ahead.
Yeah, so just in terms of education within communities, a big part of the program that we're running, which is across Zimbabwe, so Harare, Bulawayo, and specifically Mashonaland East, is education. So we have material that's in Shona, English, Ndebele that addresses menstrual health, puberty, frequently asked questions, and then myths and taboos. So the idea that using pain medication during your period makes you infertile, that's completely untrue. And so we address problems like that and talk through that, and then also offer them products so that they're making an informed choice. And so that work that we're doing is also about collecting data on what are the questions that girls are asking the most when they come to our service. What are some of the barriers that they face? So the idea that they get education within our program and get a menstrual cup, but then go home and they have their parents tell them, oh, you can't use a menstrual cup because you're not married, or it may affect your virginity. So those are the type of issues that we're collecting data on and collecting and creating information and education material, not just for the girls, but also for the community to address those issues. And just to say, when you speak about menstruation has been an issue for so long and people haven't really done anything about it, I think that is completely true. But I also want to emphasize that right now is what we're in a period of what I like to call like menstrual momentum, where people really want to get engaged with menstrual health, from funders to implementers to program coordinators. And so if you are involved in a project that's to do with menstrual health, if you're creating products, if you're creating information, if you want to get involved in that kind of work, if you need funding for that type of work, this is exactly the time to do so. There are lots of funding opportunities available, and it's really a matter of you being proactive and applying for them, because everybody wants to attack menstrual health and end period poverty.
I'm so grateful for that, right? But at the same time, I will ask, are you having these programs or projects in what we might like to term less or disadvantaged communities? Because the thing is, it is not about the advantaged or the disadvantaged. You've got people in the Dales, in the north, like people like to say, who are facing the exact same problems. We want the same educational materials that you are availing to that rural girl. It's also the same for me when people look at other people and then they say, okay, she comes from an advantaged side of the town or whatever.
So she
but
knows everything.
the thing is, we do not have the information. You've got this young lady there. We do not have it. It's not a class problem, I'm sorry to say.
Absolutely.
So if I'm glad you've got a program like that that's running, and I would like for you to expand it to the areas that you think don't need help, because they do.
Yeah, no, I completely agree.
Well, Ladies?
Okay.
I never thought I'd say this. Ladies? This is clearly an emotive subject, and clearly there are a lot of loopholes, and clearly there's a lot that hasn't been done. But what I just want to remind everybody is we've had the important first step of actually sitting down over 4 episodes and talking about something that people were absolutely not talking about. And I'm also going to mention the fact that one of our partners, PSI, is actually launching a national program where they're going to be addressing issues to do with MHM. And this was not entirely inspired by us, but the fact that we also contributed to people around the country to actually start talking about this issue. And again, back to the Swedish Embassy, thank you, because it requires funding to sit here and say we're having a program and have, roll it out over 4 episodes. This is an important first step. And I want to come back to what you said about menstrual momentum. This is it. I can feel it. And I'm sure a lot of us can feel it. We've been here before. Some of you have been panelists here. And we've actually made a change. We've got amongst us, we've got Baldwell, we've got Glenn, who's here, who was also on the first panel. And to think that we've got young men who are also a part of this discussion shows that we've really had these amazing strides. It's what it is it's a marathon and not a sprint. But the marathon has started and we're on track. And to round things up, I want to start with you, Willis. Just in short, your takeaway as we go on this call to action.
All right. Schools Without Walls. I was just listening to my lady friend talking about the inclusion of the necessary conversations, whether in rural areas or in urban areas. And I've noticed that the Schools Without Walls approach actually works where people have conversation and you gather information of what people are talking about, the things that concern menstrual health education. And I just want to say that my organization and I, Kai Roots Foundation, are 100% behind this. And I'll use whatever strength, gifts, and talents that I have to make sure that this happens, because you find that part of the information accumulation, or we put this in film and television, we start taking them out there, adverts, making sure that these so-called faces that people like, it may not be myself as a musician, find some guy that is like hot on the charts right now and get him out there and talk about this and involve men, because it has become such a taboo, and our man of God was talking about it, where the church has become the hindrance, the point of hindrance, the brick wall where people hit whenever they want to talk about such things. So we want to say, let's break those walls, let's start afresh like infants and say, we're going ahead, we're forging ahead as Zimbabweans, because it's a national issue, not a women's issue.
Thank you.
Thank you.
And then we're wrapping up. I really would have wanted to talk to you a lot more. I wanted to put people in a bit of trouble and say, what do we do to the government if they don't do anything about this? We want to, and that's why you need a lawyer. But yeah, let's see what they're going to do without us having to drag them to the courts. But starting from you, real quick, as we close our call to action.
It's just really briefly, I think that this is an amazing platform, and I think we need to continue this conversation outside of this program. So parents, be speaking to your children, like teachers to your pupils, like fellow girls speaking amongst each other, peers, and all of that, because that conversation is really going to ignite advocacy and for demand for better conditions for menstrual health overall. And just as, pillars or stakeholders, to say we each have a part to play, but we have to play it together. It's very much a team effort. And so let's hope that this opens channels for knowledge sharing and partnership moving forward.
Thank you. Doctor?
Thank you. So this has been a good opportunity. I think this subject is not discussed often. So for us as Ministry of Health and Childcare, I've noted the contributions. We need to take charge of this issue. And we also need to disseminate information. But again, I will say that as a country, we really need to make sure that the pads are available at the lowest cost, if not for free. So thank you for giving me the opportunity to be here.
Thank you for coming. I'm going to skip you, Ambassador, and come to Madam Esther. She's going to be in the country for quite a while, so I'm going to end with somebody who's leaving.
Before you skip me, because obviously I'm leaving, but Sweden remains committed to this issue, and many of the grants that we have provided to our partners here run for a number of years. So I just would like to stress that our commitment is long-term, and it's running throughout the years with our partners here in Zimbabwe. So if I may just, as I'm leaving the country, Sweden remains, and our commitment remains to menstrual hygiene in Zimbabwe.
Thank you, but you're not off the hook yet. I'm coming back to you still.
Thank you.
Okay. Just to say thank you. It's been a very interesting, short, brief dialogue. I would have loved it to be a bit longer. However...
Well, talk to our sponsors to add a little bit more. And then we, I don't know.
I think we should go beyond having it on heartbeat only. I think we need, for me, what I'm listening and hearing is let's get out there and do what's right for all women and girls, leaving no one behind. And I think what's really critical is let's talk about choice. I am a non-believer, and Sofia, you may not know this, I don't believe in projects. I believe in initiatives. Because when you say it's a project, menstrual health management is not a project. It is a process that needs to be responded to. And I think what's coming from the audience and what I'm hearing loud and clear, we could do more. And it's everybody's responsibility. And let's make sure we create a favorable environment. And I think as development partners, our role is to work with government to ensure a favorable environment to implement and operationalize policies, laws, because we make a lot of policies and laws and then they gather dust. So what I look at it is let's move more action and not projects, but initiatives that can be scaled up. And what I also hear, which I believe in, let's do made in Zimbabwe, for Zimbabweans, by Zimbabweans. And I think that's why at the beginning I said, I believe people should be capable of independent existence. And that's the only way to do it. So let's move and talk less and do more.
Thank you. Thank you so much. Are we taking the government to court Monday?
You joke about litigation, but actually, you know, the way the Constitution is structured, it's structured to be transformative. And one of the ways that you transform the Constitution, you talk about the dry letter, is you give expression to the dry letter. And one of the ways you give expression to the dry letter is through litigation, with the courts coming in and giving expression to the rights. You rightfully pointed out that our Constitution provides in Section 76 to a right to health care and not a right to health per se or a right to reproductive health. And that's something that the Constitutional Court can build into our rights framework. Our Constitution acknowledges that the list of rights in the Declaration of Rights is not exhaustive. And that's one way that this can be built into our rights framework, and we can develop our Bill of Rights in that way. So litigation you joke about, but it could actually be another step forward that we can take, not as an adversarial tool, but as a tool to transform, transformative adjudication is what they call it, and give expression to the provisions that are there in the Constitution. The issue that she raised about stigma is actually quite an important thing. When we talk about period poverty, we immediately think about the finances and we forget about the stigma and the human dignity element to it. Yet it's a broader concept to that. And I was reading before as I was preparing for this, and I noticed that in the UK, about 46% of girls in the schools between 11 and 16 had reported in that survey to have been discriminated upon, to have been laughed at, to have been bullied in a way when they were on their periods. And 9 out of 10 of them had said that they have thought about not going to school when they were on their period. So there is need for that education, and as a next step to start educating not just the women but also the boys, because a lot of that is because of the boys and the lack of awareness of the issues that are involved. And we need to start having these conversations in schools, in primary schools, in high schools, so that at least the boys become part of the solution and we become part of the conversation, and we're able to sit in platforms like this and have meaningful contributions to the dialogue and to conversations that will be taking place. And my last point, last call of action is just really the policy formulation. We need to start to there's been a lot of talk around having locally grown products. We need to start creating the policy and legislative framework to ensure that we have locally developed products. We need to start to see if we're still dependent on imports, how we can make those imports easier to bring in, how we can remove duties and excise. That will allow us to have affordable products that people can use, and we can start to have the people restoring their dignity and having a seat at the table, so to speak, where they speak as equals.
Thank you. And I would like to say to our viewers, over the past couple of weeks with regards to issues of stigma, we had partners that came, communicators who came and pledged to communicate and remove the stigma, people that society listens to, people that move society. I would like to thank those people. We had Stunner, we had Jar Praiser, we had Jar Signal. Today we've got Willis Watafi, and these are partners who will come and speak to our communities, to the boys, and tell them that there's nothing to laugh at or nothing to laugh about with regards what is essentially the source of our origin. Finally, I'm back again to you, Your Excellency. Thank you so much to your country, to your people, and for your gracious support that has brought Heartbeat and our hearts beating. And thank you for rushing from Malawi and coming straight to our studios for what has been obviously a very, very great discussion. And it's sad to see you leaving, but our loss is somebody else's gain, and we hope you're going to have as much enjoyment and fun wherever you go. Of course, there's never going to be as great climate as we have, but I hope they're going to give you the best they can have.
Thank you, and my heart will continue to beat for Zimbabwe and for the Zimbabwean people wherever I am. So thank you very much for highlighting this important issue, partnering with us, and for all of you to be here, and for everyone who's watching this important program. Thank you.
Thank you so much. Thank you to my panel. Thank you to my guests. Congratulations to our chevening student in waiting. We've got one of our gentlemen who was on the very first panel. Glenn, we wish you all the best where you're going. Snigiwe, thank you for coming. Sendisa, thank you for using your license. I could mention all of you. You have been great. You have been wonderful. I've had absolute fun getting to know you. And as has been said here, let us continue with this conversation as we go forward. And to you, our dear viewers, thank you so much for being on this 4-part series. Of course, Heartbeat will continue to beat as we go forward and start talking about other issues that are related to your health and your wellness, because your health is your wealth. Heartbeat will not be back in a heartbeat. It will be back next week.
Menstrual health is not just a women's issue. It affects all of us.
As a woman, I understand that my period is a delicate time for myself as well as for other girls who go through exactly what I go through.
I'm Ruti. I stand with women and girls in breaking the silence and saying my period is not shameful.
I'm Andy Hodges. I stand with women and menstrual health. Make sure you break the silence and break it now.
My name is Candice, and I will be helping you break the silence on menstrual health and menstrual health issues.
I am William Chikoto, Zimbabwe's editorial executive.
Farai Matani, the Group Finance Director for Zimbabwe. I stand in support of women and girls in breaking the silence on menstrual health.
It's not a women's issue, it's a developmental issue. Let's break the silence.
My name is Tendai Marion Maziofa. I suffer from endometriosis. I am here standing with every girl and every woman in breaking the silence on menstrual health issues.